We do see ER presentations increase significantly around the holiday times, particularly the day after holidays, but also on the day itself. Some of the reasons for increased visits to the emergency department during the holidays may be due to holiday-specific injuries or accidents that may only happen in that context, but we also see increased volume of the normal bread-and-butter emergencies. Injuries that we see, particularly falls off of a ladder, are extremely common this time of year as people choose to decorate their houses, and a lot of these injuries can be much more serious than you might expect. Falls from heights of greater than 3 to 5 feet, depending on how you land, can result in hip fractures, internal bleeding, and head injuries and concussions. In particular, patients who are taking blood-thinning medications are even more prone to serious injuries from falls of heights that you may not expect to cause such serious results. It's important to keep in mind that when your routine is disrupted, some normal things that you have in place for safety may also get sidestepped. This is particularly important when we deal with children, okay? Children have a tendency to put things in their mouths, chew on them, eat them. This can be electrical extension cords going to your Christmas tree. This can be small little ornaments or decorations that they could lodge up their nose or aspirate into their lungs. This could even be things that are potentially toxic or dangerous. So this time of year, whether it's due to the weather getting colder or decorations we put out for the holidays, candles, lighting, things of that nature, often results in increased incidence of house fires, burns, smoke inhalations. So there are a couple of things that we can do to decrease the risk of that happening to us. If you like to put up a tree in your house for decorations, make sure that you keep it watered well so it doesn't dry out. The drier it gets, the more prone it is to igniting and causing a fire. If you keep out open flames and candles, be aware that children, animals may knock those over, so to keep them out of reach of where they may encounter them. So a lot of times around the holidays, we may get more bumps, bruises, sprains, and particularly cuts and lacerations than we would other times. This may be because we're more active with our families or because we're preparing larger meals with knives we're not used to. Although these may not seem serious at the time, there's a tendency to ignore them because you don't want to disrupt the holiday setting. I would urge you that you should probably seek medical attention if you're even thinking about it, because delay in doing so may cause some problems down the road. So for example, if you experience a cut or laceration, we know that delaying repair of a laceration by more than 6 hours greatly increases the chance that it may become infected. Another common practice is for people to ignore their symptoms because they don't want to bring them to the attention with all their family around. I cannot emphasize enough the importance of seeking immediate medical care if you experience any symptoms of heart attack, stroke, seizure, or anything else that may be otherwise related to an emergency. This would include chest pain, shortness of breath, passing out episodes, facial droop, visual changes, or sudden onset of confusion. Whatever you're doing, call 911, get it checked out right away. A lot of people travel during the holiday season, and that may mean going on the road trip to see some family. We know that there is a big spike in motor vehicle-related accidents and deaths during the holiday season. This may be up to 5 times what we normally see on any other given day of the week. A lot of these are very preventable, and there are some things that you should practice every day traveling and driving, but that are all the more important now. First of all, never drink and drive. When you're traveling and driving for the holidays, remember, seatbelts save lives. They reduce your risk of dying by about 50% in major car accidents. Additionally, you load up your family in the car to travel to see family. Make sure that your children are secured in the age-appropriate safety device, whether that's backward-facing car seat for an infant or a booster seat as they get older. So the great part about the holidays is we often get to see family members whom we haven't seen in a long time. Very commonly, I brought a family member into the emergency department on a holiday because they're not really acting the same way or how we remember. I think it's important to recognize that in many cases, 1, 2, even more years may have passed since you've seen your family member last, and changes can happen slowly over time. Dementia in particular is a highly complex constellation of different disease processes that can cause a gradual change or decline in how your family member thinks, behaves, walks, and functions. Any sign of this definitely needs medical evaluation, but there are certain things that should prompt an immediate presentation to the emergency department or calling 911 versus seeing your primary care doctor or specialists in a very timely manner. If you notice that your family member experiences anything like seizures, sudden onset confusion, lethargy, stroke-like symptoms, visual changes, I want to see that in my ER right away.